Hey there.
Hello.
Hey, I'm Tim. I'm one of the second-year family medicine residents.
Nice to meet you. I'm Cody. I'm your medical assistant today.
Great, Cody. So I'm here for my first day in the geriatrics rotation.
Well, welcome.
Thank you. And I was just told to work with you and the team and seeing our patients this morning.
Perfect.
So
I have a list here pulled up
Okay.
of the patients we're being seen. Hello, Lou.
Hi.
How are you?
I'm good. How are you?
Wonderful. This is Tim. He's working with us today.
Hi.
Tim, this is Lou. She's our care manager.
Very nice to meet you, Lou. I should probably say at the outset that I don't have a whole lot of experience working in teams, but I look forward to getting more experience with that. And I've worked with a medical assistant before, not with Cody, but with another medical assistant, but I haven't worked with as a care manager. Is that your role here?
Yes.
Could you tell me more about your role in the team?
What I do is care coordination, and in that could be assessments, follow-up calls, scheduling appointments with patients. So basically just making sure the care plan is being followed and that if there's any issues, I address those. So.
I can see how that would be very useful thinking with older adults I've cared for, and I sure wish I had you in my corner with a few of my patients in the past, but I'm glad to have you today. Well, it looks like we have our list. So
Yep, you can just have a seat here and we'll go through that with you.
Okay. Well, the first one looks like is Mrs. Herrera. I don't think I've ever seen her before.
Yes, sir.
Yeah, so Miss Herrera, she came through on our discharge list, and we've scheduled a follow-up appointment with the provider. And some of the things in her care plan consisted of home health and physical therapy, which actually worked out really well for her.
Mm-hmm.
She's doing really well. She's in a senior center now, and I've been hearing only good remarks about her and her progress. So, Cody, have you had anything?
Yeah, Miss Herrera, she's the sweetest lady ever. She is a little slower with walking, but once we get her in, get her vitals checked, she's pretty easy to move along with the visit.
But maybe we can, I'll probably focus on reassessing her functional status, and maybe we'll do a timed up and go, something like that, and see how that works out. And then the next patient, Mr. Coleman, who rings a very vague bell. I think I may have seen him a long time ago.
Yes, after looking at his chart, you saw him once a year ago.
So when I was an intern in July?
I believe so.
All right.
He usually comes with his daughter-in-law. I believe last visit, he did not show.
That's right. I don't see anything.
Yeah, that's right. And so he came through on our discharge list too. And we scheduled a follow-up appointment for him. He never showed. And as Cody mentioned, his daughter-in-law is a caregiver. And so I don't know if there's barriers there as far as transportation. He hasn't been consistent, and it's been a while since we've seen him, so we haven't really had a good assessment on him.
So we'll have to look at our schedules. We may have to spend a little more time with him today, it sounds like.
Okay.
Cody, I'm wondering, would you have any time to contact his daughter-in-law? And
Yeah, I can
maybe
do that.
she could, if she's around, she could join him today. It might be really valuable to have her perspective.
Okay, I'll go make that phone call.
Great. Thank you, Cody. And then I just had a question for you, Lou.
Yes.
You mentioned a discharge list of sorts of people who were recently discharged. Can you tell me more about that?
Yeah, so what it is we get a list from the emergency department every day. And so on that list, we'll have patients who were there in the emergency department, either as an ER patient or patients who were there as an inpatient, and they got discharged.
Okay.
So with that list, I will follow up with it every morning and scan through the patients and see if they are any of our providers' patients. If they are, I follow up to see what they were there for, and then I send you a note so you're aware that.
So that's how you found Mr. Coleman.
That's right. That's how I found him.
Well, it sounds like if not for your service, Mr. Coleman might not be here today. So I'm sure you've made a lot of saves in the past. Well, great. I thought, Lou, what I would do is just look at the rest of the list for today, and then perhaps the three of us could reconvene. Once we've seen the patients, and especially after Mr. Coleman's visit, we'll probably want to get together and discuss the plan for his care. Okay, great. Nice to meet you again.
Nice to meet you too.
All right, thanks, Lou. Okay. Hello, Mr. Coleman?
Yeah.
Hi, I'm Dr. Farrell. Nice to meet you. I'm one of the residents working with the geriatrics team this month. How are you today?
Okay.
I'm just here to find out kind of what happened after your hospital visit.
There was something wrong with my legs. They were like sausages.
How's your breathing doing?
I gotta sit up at night. I can't breathe at night.
Let's see. Oh. You know, I apologize, Mr. Coleman. I've just been getting paged by the hospital all day. I have some notes from when you were in
Don't you have it on the computer?
Well, you know, all I really have here, looks like, is just the patient instruction sheet. I don't have the actual discharge.
I think this might be something.
And what's that, Mr. Coleman?
I think it's my medicines. Oh,
Okay.
God, so many stuff.
May I take a look at that?
Yeah, go ahead.
Zestoretic, and I see metoprolol. Do these medications sound familiar to you on this list?
I have them in my medicine cabinet, and they're like lined up. I don't know what they are.
Do you remember who your doctor was in the hospital?
No,
Okay.
I don't know who you are.
Oh, I'm Dr. Farrell. I work with the Geriatrics team. I'm one of the residents
Okay.
here. Is this a new list or is this an older one?
I don't know. Some doctor told me to write it down.
John, when you left the hospital, did you really understand the instructions?
No, the nurses. She talked very quickly. She's very fast. She's talking very fast.
One of the most important ones is a medicine that I see here, furosemide. I don't see that you have any doses of how much you're taking. Do you remember that medicine?
I don't even know what you're talking about.
Okay, the other name for that one is Lasix. It's a water pill.
Oh yeah.
Does that ring a bell?
Yeah, I take.
Excuse me, come on in.
Hi,
What are you
Dad.
doing here?
Dad.
Hello.
I was gonna come get you.
I'm Dr. Farrell. Nice to meet you.
Oh, nice to meet you.
Hi, come on in.
Hi. I told you I was gonna come get you for this, remember?
I can do it myself.
Melanie,
know, I know.
I apologize. Staff told me you might be coming, but I didn't know what
Okay.
time you were coming.
Yeah, I thought I was gonna pick him up, so
But, okay.
I was on his way to his house.
Mr. Coleman, do you mind if I chat just for a moment with Melanie?
Chat all you want.
Okay, okay. This
Right
may.
here.
I have to admit, Melanie, I'm not getting very far. I'm trying to figure out your dad's medications here.
Yeah.
And I'm having a kind of a hard time really piecing things together. And any help you could give us
Sure.
would be really
Is that
helpful.
what he gave you?
This is it. Would you like to see it?
She wrote that.
Well, I wrote this a couple of years ago, Dad.
Do you know anything about what happened to your dad in the hospital?
Yeah, it was really hard. I wasn't, because I couldn't be there because I had to take care of my kids. So this is actually, I found this.
Oh, okay.
I think that's the
What's this-
discharge
what's that?
papers.
Oh, you know what? This is similar
Where'd
to
you get
what.
that?
It's in your
I
jacket
have.
pocket,
What were you
Dad.
doing in my jacket pocket?
I was looking for papers like that.
Okay.
I'm just trying to help you, Dad.
Okay, so these are the patient instructions from the discharge, and so they wanted you to see your primary care doctor, Dr. Smith, for a follow-up within 2 weeks. Did you happen to be there at the time of discharge?
I wasn't, yeah, like I mentioned, I wasn't there.
How does he do with things like how he's able to manage medications and things like that?
Yeah, I try to go there as often as I can. Usually I come and bring him a meal every night after work. But recently I've been finding more pills like underneath the microwave or on the floor.
How does he do with things like preparing meals and things like that?
I cook.
You cook with the microwaves, Pop.
Yeah. I got those little noodles I cook.
Yeah, I don't know where he gets those. I guess he
I
goes.
got them downstairs in the 7-Eleven. I get them, and the ramen, something like that. Ramen noodles.
You
They're
know what?
good. They're very tasty.
We're going to have to talk about those. Those have a lot of salt in them.
Sorry.
Oh, that's okay. That's okay.
Hold on. I'm sorry.
Sure,
I'm sorry.
sure. Oh boy, John. John, it sounds like you're coughing a lot. This might be a good time to listen to your lungs. When you're ready, I'll help you to the exam
You
table.
don't have to help me. Help yourself.
Okay.
Jeez.
Nice, slow, deep breaths. Mr. Coleman, I'm hearing some fluid down there in the lungs. which might explain why you're having some trouble with your breathing there. And I'm just going to take a look at your feet there, look for any swelling.
I told you,
see
they're like sausages.
Yeah, so a lot of swelling on both sides. Oh, come on in.
So what are we gonna do with him?
Well,
Nothing with me.
Oh, come on.
that's a good question. Mr. Coleman, has some water in his lungs still. Was he taking the furosemide, or is it not enough? So we got to figure that out. While we do this, I'm going to go chat with the team that I've assembled outside
Okay.
and sort of come up with some recommendations for you.
Okay.
And we'll still have another chance to discuss that if there's still any questions. And I'll certainly make sure your doctor has the information. We can
Okay.
kind of go from there.
Okay. Great.
Can I ask one other question? How did you get here today?
I drove.
Okay, did you find the parking spot okay? And
Well, I had a little trouble.
all right.
I found his car kind of parked
Oh,
a little funny.
okay. At least you found a space. Usually you
Yes,
can't find a
you
space.
did find 2 spaces, huh?
All right, 2 spaces. All right, all right. Well, we're going to need to make sure that that's addressed, and we'll talk about that some more when I come back.
Okay.
Can I help you down from the table?
Yeah. Oh, I don't need no help. Leave me alone.
Hey, come on, Dad.
I have a rule that nobody falls in my office, so I'm just going to give you a hand. Okay.
There you go, Dad. You got it.
All right. Melanie and Mr. Coleman, I'm just going to step out and kind of gather my thoughts, come up with
Okay.
some recommendations, talk with our team, and then
okay.
we'll chat in a few
Okay.
moments. I'll be
All
right
right,
back.
thank you.
Give them a chance to sort of
Thank
rest a little
you,
bit.
Dad.
I never wanted to be a burden to anybody,
Oh, you're
and I
never
don't.
gonna be a
Oh,
burden.
sure I would. I can't.
We love you. The kids love playing
I know,
with
they're
you.
good kids, and But I watch TV at night, and if I want to go with coffee with my friends, how
I'll be
can I
happy
do
to
that?
take you.
You work, and you got kids, and I mean, you got
We
so
can
much
we'll
to
figure
do.
it out, Dad. Hey,
I've seen it happen. I've seen what happens to families that have these old people walk in, and they smell. Old people smell.
we'll make sure you don't smell. Hey, look, we'll talk about it later, okay? We'll talk later. All right.
Okay.
Hi.
All right, so thanks for your patience. We're just talking with the team out there
Oh,
about our
Okay.
recommendations. And I know we had a chance to talk a little bit earlier. I just wanted to give each of you just a summary of what we discussed about the plan. Okay, here's one for each of you.
Thank you.
You're welcome. I just wanted to emphasize one very important point, and that's with the furosemide, Mr. Coleman.
Who?
The-
The water pill, the Lasix.
Oh, okay.
Yeah, and that medication we'd like you to take twice a day. It's the 40 milligram tablet. All right, well, pleasure meeting you. Thanks for your time.
Yeah. Thank you so much.
You're very welcome. Need a hand?
No.
Okay.
Okay, Dad. Let's get you home.
Okay. So that sounds like a good plan.
I think that's good.
Talk to Dr. Farrell about that.
Hey, Cody.
Dr.
Hey,
Farrell?
Hey, good to see you again. I was just finishing up with Mr. Coleman, and if this was a good time, I thought we could maybe just huddle and talk about the visit.
Okay.
Great. I just saw him, and I had a chance to talk with the attending and for today. And the first thing to say is I've got this big stack of paperwork. I've got patient discharge summary, a few medication lists to reconcile, which I'm sure you've seen before in patients and the Geriatrics team. What I thought I could do is just mention some of the things that we noticed during the visit and see what you may have thought of as well. From my standpoint, I'm concerned that there still seems to be a fair amount of confusion about the plan, at least at the time of discharge. And I hope we can at least clarify some of the basic medical issues before Mr. Coleman leaves the office today. But I was wondering if either one of you had a chance to talk about him while I was in the room.
Actually, we found a service that would probably help Mr. Coleman. It's from Area on Aging, and it's for transportation. So they would help get him here to his doctor's appointment and also get him back home. And Cody actually was telling me that some patients have this service already, and it works.
Yeah, since we have a number of patients who frequently no-show, we've introduced this system to them, and they tend to be on time to their appointments as well as early.
Oh.
So it makes the care just go by smoother and faster.
Well, it sounds like a program I wish I had known about earlier in my residency. So I'm glad that we're using it now, though, and aware of that. So I think he'll really benefit from that transportation program.
So if we could put that in the after visit summary, I think that would be really helpful for them, and then I can go and explain to them.
Oh, and that's really helpful to know about, 'cause I don't always do that. Can you tell me about how you work the after visit summary?
So Cody, you do a lot of that. I will probably just put a lot of my social work with Area on Aging in there. Cody, can you explain
Just
that?
the after visit summary with your notes and anybody else's notes that they put on there. You print it off, and it kind of just tells it whatever you wrote in there. They can read it if they forget what we talked about in the exam.
Okay.
If we made an appointment, it'll be on there. Has our number in case they need to call.
Okay.
Any of the medication. It has their most recent medication list if you just had gone over it.
Terrific. Okay. Well, sounds good. I think if all right with you, both of you, Cody, if you wouldn't mind, maybe we'll find the next patient and get them roomed and their vitals, and then it sounds like, Lou, you might be able to talk to Mr. Coleman and Melanie about the transportation plan that you identified.
Yeah, so I'll probably go in with them and just give her the contact and how to get set up with that program and make sure it's clear. And we'll also put that on the after visit summary.
And Cody, if you can look for the next patient, we'll just keep running through the list.
Will do.
Okay, great,
Okay.
thanks.
So I think that will do right there.